Has this approach that which we're going to get into more detail with, the approach that you use, was the doctor that you are talking about who you had met, was he doing a similar approach, or have you fine-tuned it a great deal?
I have definitely fine-tuned it. One thing that's always bothered me about natural medicines or alternative medicines is, you might, people that see alternative practitioners might be given a list of supplements to take. And you might have, there's a lot of people walking around with cancer that feel fine, but, the cancer might be growing or still in their body, but they feel fine, but they detect cancer. And you take a bunch of supplements, you might not feel any different. How do you know if they're doing anything for your body? Are they really doing what they're supposed to? Are they helping the immune system, like it might say on the bottle or on the ad from the product that you're on? How do you know? And that's what's always bothering me, is I saw plenty of naturopathic doctors give patients this supplement and that supplement and say it was doing this, it's doing that. And hopefully the CAT scans came back better. But there's a lot of people that are in remission, and, do they need to take all these supplements or do they not? How do you tell? So I've took my knowledge in laboratory medicine, because that was my undergraduate, and have integrated that into my practice. So what I do, before I put anybody on any supplement whatsoever, I run a battery of lab tests, blood tests, mostly blood tests, to check the status of their immune system.
Yeah, I found this fascinating. Tell a little bit about the tests, if you don't mind.
There's a way that you can just take a blood sample and send it to a lab. There's several labs, a couple in California, that will take your blood and isolate all the different types of immune cells. People might not realize, but the immune system is, very, very complex. It's kind of, similar to, we have doctors, we have lawyers, we have accountants. Everybody has their own job, but we're all human beings. We have white blood cells in our body, and there's all kinds of different types of white blood cells, and each of them have their own function. Some are to fight cancer, kill cancer. Some function to signal the body that there's cancer in the body, but they don't kill the cancer, they just signal other cells. Then there's cells that make homing devices that land on cancer, that mark it for destruction. Then there's cells that suppress the immune system so it doesn't go haywire and attack everything, our joints and our skin, and cause autoimmune diseases. So everything has its own function. So what some of these laboratories do is they measure each one of these cells. And there's lots and lots of research that's being done that shows if, for example, these natural killer cells that we have in our body don't kill cancer cells in a laboratory, they won't kill them well in the body. And there are supplements that address that. But that's only one aspect of the immune system. The natural killer cell is only one component.
I found one of your newsletters online with an article, The Importance of Monitoring and Manipulating the Immune System in Breast Cancer Patients with Naturopathic Medicine. And with your permission, I will put a link to it in the show notes, because
that would be very helpful for people to read that.
It taught me a huge amount. I was amazed by all the different, I had heard about all the different kinds of immune-fighting cells, the lymphocytes and all of that, and the natural killer. But you really have it down to, through your research, a science.
It is a science.
It is a science. where you say, for instance, lymphocyte counts. You should have normal level of lymphocytes, et cetera. Low lymphocytes counts prior to chemotherapy may predict a poor response to chemo. And then you have the citations from all the different articles.
Yes,
You've done a ton of research.
I've spent countless hours in the library collecting articles, reading articles thoroughly, to try to put some structure to complementary medicines. Just like there is structure with conventional medicines. Like breast cancer, they when they take the tumor out, they measure it for estrogen receptors and other receptors, and then there's drugs for that. And they don't put you on those drugs unless you have those estrogen receptors or something. Well, the same thing with natural medicines. I don't put a person on something for their natural killer cells if the natural killer cell test is fine. But if some other test is not fine, then I put them on something specific for that. And that way we individualize the protocol, and we're using a scientific basis to select what a person needs rather than maybe something more archaic. I mean, I'm not saying it's bad, but pulses and tongues, some people do that. Some people do kinesiology. I personally feel comfortable using some kind of laboratory test because that's my background. And that's how I select what I use for a person.
So from my understanding, when somebody comes in your office, you do these panels to find out where their immune system is now, correct?
Exactly.
And then
I retest after I put them on certain supplements that are supposed to correct those imbalances and make sure that it's doing what it's supposed to be doing. That way I feel good that the supplement is having an effect, and I'm not just taking the word of the company that it's supposed to have the effect on the immune system and confirming that. Some people don't respond to the same way as others, and you don't know if it's really helping your immune system unless you test, because you can't tell, you can't feel your immune system really. Like some people say, well, I don't get colds and flus. That's not exactly the same thing as when you're fighting cancer. And people maybe never got a cold and flu and still get cancer, and so it's different. You need to have a blood test to determine if it's really having an effect on your immune system.